Good evening. I'm Ashley LaRoche, one of the doctors from the Animal Hospital of Statesville, and this is my lovely assistant Kyle, and we are here for our first Fireside chat of the season. It's getting a little dark and cold outside, so we've had to move indoors.
It's actually pretty warm out, but it's definitely going to be dark by the time we got up, set up.
And cold.
Then you couldn't see us.
So we are gonna hit on something not real common, but enough that people might be interested in it, called Megaesophagus, a condition that usually affects dogs more so than cats. So Megaesophagus is where the esophagus loses its innervation and motility. So
Innervation being
nerve
feeling.
Yeah, it's nerve function. So it loses the ability to move food from the mouth into the stomach. So it dilates and food sits in the esophagus instead of, when you swallow, having it move down into the stomach. So
kind of like a snake when...
Yeah, kind of. That's normal. Like you have constriction in your esophagus to move a food bolus. That stops happening. So the food just sits in the esophagus, and then all of a sudden the dog will drop its head and it just falls out through the mouth. That's regurgitation. It's a very passive process, unlike vomiting, which is an active process where the dog starts kind of walking around, doing heaving. Abdominal pressing, heaving, retching. Right. Regurgitation. The most common sign in Megaesophagus is definitely just passive regurgitation.
Okay. Can it be prevented?
Megaesophagus, that's a tricky question. So there's congenital Megaesophagus, which means it's inherited in young dogs, puppies, and usually you will see it when they start eating solid food. They'll start regurgitating. So some of those dogs will outgrow it to some degree. Usually there's known inheritance in wire-hair fox terriers and miniature schnauzers, and those that are genetically set up for it. And then we'll tend to see it in Irish setters. German shepherds are the big regurgitation breed.
I was surprised to see some of the smaller breeds in there. I didn't realize they were in it. So I knew about the German shepherds, of course. But
labs, retrievers. Can it be prevented? Not necessarily. So it just depends on the underlying cause. And the question is, can we correct the underlying cause? So.
And you already said it can be genetic, so should people who are breeding their dogs be concerned about this, and what should they do about it?
Yeah, absolutely. So if you're one of the breeds that has a known genetic inheritance, they can actually test for that potentially. It's got known recessive traits. But otherwise, looking through bloodlines to see who, if you're one of those target breeds, who has does Megaesophagus run in that line, that sort of thing, and maybe not breed those. Yeah.
Okay. So the other symptoms in Megaesophagus, besides the just regurgitation, is there anything else that people should be kind of forewarned about?
So usually they'll start drooling, have a lot of drool. Sometimes dogs that regurgitate and with Megaesophagus are very prone to aspiration pneumonia. So basically those signs where the dog gets a fever, doesn't feel well, has nasal discharge, those sorts of things. Some of these dogs get really thin because they don't keep their food down. They don't get enough nutrition.
So aspiration pneumonia is basically when the food goes down the air pipe instead of the esophagus.
Basically, it slides back up out of the esophagus and then moves down into the air, the windpipe. Yeah,
not a
the
good
trachea.
Thing.
No, it's not. And unfortunately, that is probably the biggest complication of a dog that has Megaesophagus.
So is that the only way it's diagnosed, by the symptoms? Or you said there can be a test?
Yeah.
Or is that just test to see if they're genetically prone to that?
That's just genetic testing. But if we suspect a dog has Megaesophagus, so they're showing regurgitation signs, they're drooling, losing weight, you're a German Shepherd or even any breed, we're going to start with x-rays and we're going to look at the whole chest and neck, and oftentimes we can see the big dilated esophagus, and that's pretty diagnostic for a Megaesophagus. It doesn't tell us why it's there, but it tells us that this dog has it, and then we have to manage it appropriately.
Okay. Can it be cured?
So that depends on what the underlying cause is. A lot of times dogs, it's idiopathic, which means we test and we don't know why it happened. Those cases usually are not curable. So that dog has to be managed medically, which we'll probably talk about here in a bit. So there's various conditions. There's esophageal strictures. So that's like a band of tissue, kind of in the esophagus, scarring, so to speak. So you can actually sometimes balloon that stricture, because what happens is the esophagus dilates in front of the stricture. So if you fix the stricture, sometimes the dog will get better. Not
so
super
it's kind of like an arterial stent.
Yeah, kind of.
Opens the esophagus up,
kind of. And young dogs that have what is called a vascular ring anomaly. So what that means is there's a band of tissue in the thorax that is a remnant from fetal development that should have went away when the puppy was born. Puts pressure on that esophagus, and then it dilates in front and food can't make it down. So you can correct that surgically.
Okay.
Myasthenia gravis, also basically that's an autoimmune disorder to the nerve receptors in the esophagus and in other places too, skeletal muscle, things like that. So that disease can be managed with medication quite successfully sometimes. Sometimes the megaesophagus stays, though, despite managing these dogs. But there are some if we've got an underlying cause that we can fix, we might be able to resolve the megaesophagus.
Oh, that's good to know.
Yeah. Unfortunately, a lot of times we can't find an underlying, reason for it. So we just have to kind of deal with it and manage it as best we can.
And you noted that the complications of it are the malnutrition because they can't absorb their food and aspiration pneumonia. So it can lead to death if it's not
it can.
treated or diagnosed or whatever.
Right.
If they're not prepared for it. How can a person whose dog has megaesophagus, how can they help their dog?
So usually it requires usually feeding practice changes. So a lot of dogs use what's called a Bailey chair. So basically if you take the neck and chest and move it above the hips quite a bit and feed in a vertical position, so you use gravity to help you. So when the dog eats, gravity helps move the bolus of food into the stomach. And so when you put them in this position, there's actually chairs that you can make for this. I've had also owners feed on high stairs and things like that. They got to stay in that position for 20 minutes. That's where the high chairs are nice, because they kind of make the dog stay in that position for 20 minutes to allow that food to get into the stomach. And once it hits the stomach, it's not going to come back out unless the dog actually vomits. So
is that well tolerated by dogs?
I would say for the most part, yeah. It may take a little getting used to, but I have a fair amount of people that manage dogs pretty successfully with megaesophagus. They might, like a big dog, may not be able to use the chair, but they have some other tricks at raising that front end, for 20 minutes, and a lot of training as well. So,
is there a specific diet that dogs with megaesophagus have to?
Right. So every dog is different. Some will do better with kind of more of a gruel feed, that just helps slide it down faster. Unfortunately, if they regurgitate, the gruels might make the dog a little more susceptible to aspiration pneumonia because they're slimy and, gooey. Oftentimes small meatballs, just hand feeding small meatballs, sometimes that helps. You just want smaller food boluses to go down, and every dog's different on kind of what they do better with. So you just kind of got to try the different food substrates.
If your dog's a gulper to begin with, it probably is.
Yeah, and you're going to want a good quality, kind of high calorie, high protein diet typically. Just because nutrition may be an issue for some of these dogs as far as getting enough calories, especially if they're a big dog.
So my next question, you kind of answered as well. Will my dog ever be able to eat normally again? If it can't be cured, if you don't know that or can't treat the underlying cause, then
unfortunately, this is what the family and the dog face for life. It's definitely management, which can be really difficult if you go on vacation, some things like that. But no, unfortunately, it's a lifestyle change that you have to have. It's like giving insulin. Well, we have to feed like this. You can't skip or change or whatever. It could be detrimental to the dog's health.
Any medications?
Yeah, there's one out there called sildenafil. The human market might be more familiar with the word Viagra, but what that medication does specifically in dogs, it helps with pulmonary vessels, reducing hypertension, but in this instance, it also opens the lower esophageal sphincter, so that's the junction between the esophagus and the stomach, so it'll open that to allow the food to go down in there. Yeah.
Okay.
Some dogs will respond to that, not all of them. I've had some of them, they don't do, it wasn't effective in that particular dog, so.
Okay. So the effect was not as planned.
Yeah, right,
Okay.
right. That's kind of a newer modality, and it's inexpensive and worth trying, but it may not work. It may or may not work. So yeah.
So treatment is just trying to feed them in a proper position and
take care of underlying causes if you can. Like myasthenia gravis, we could treat that. Like underlying tumors and things like that, those can be, challenging, obviously, would herald a guarded to poor prognosis if that's one of the underlying causes. Every once in a while, a dog with Addison's disease or low cortisol will get megaesophagus. So if you correct their Addison's, sometimes their megaesophagus will go away. So yeah, basically, if we can't find an underlying cause, this is what they have to live with. And that's why they say a lot of times the older dogs that have idiopathic megaesophagus have probably a little bit worse prognosis than the young dogs who have the potential to outgrow it. Yeah.
Okay.
Yeah.
Well, can you think of anything else we need to cover on that?
No, I don't think so. I think we've got it covered. Just to say that if your dog does have megaesophagus, definitely twice yearly exams would be really important to have us auscultate that dog and do blood work on that dog and, things like that just check in to make sure the lungs are healthy and, things like that. So it's not a death sentence. It's just, definitely management. It can be a death sentence if they repeatedly get aspiration pneumonia, but overall it's just more of a lifestyle management.
Okay. Well, now you know about megaesophagus.
Yes. If you suspect your dog has megaesophagus, let us know. We can get x-rays. And as an aside, sometimes we do contrast studies where you put barium in the esophagus and look at it just to document it. And sometimes we refer them for what's called fluoroscopy, which is a moving x-ray as they watch the dog swallow and things like that. So just FYI.
Okay.
All right.
Well, that's it for today.
Yep.
Stay warm.
Yep. Stay warm and see you next month.
All right. Bye.
Bye.